It is now my pleasure to introduce our final speaker, the man of the hour, the man who promised not to let this community down and is keeping his promise today. Please help me welcome Supervisor Mark Ridley-Thomas.
So I think it's fair to say that we are today standing at the epicenter of great opportunity to address the healthcare crisis, not just in South Los Angeles, not just in the 2nd Supervisorial District, but indeed, as has been referenced earlier, we are on to something that will get the attention of the entirety of the nation. Rather than throwing up our hands, I think it's worthy to acknowledge, Dr. Norris, that the challenges with which we are presented, we will not be deterred. We will be planting our shovels today to create a new reality. That's what we're doing. Somebody ought to say new reality. New reality! Y'all doing good today. New reality. And so we are building what I think is a foundation for a new integrated healthcare delivery system. Dr. Kathy, a new integrated health delivery system. We are bringing those that we think lack the critical elements together necessary to spark what may be defined as a renaissance of wellness in this community. And those elements include the dedicated persons from whom you've heard that will work at this new facility, and these facilities will be state-of-the-art. And there are several. This is one of many. The new MLK Hospital, the new MLK MAC, dealing with both inpatient and outpatient care, the improved Humphrey Health Center, the Augustus Hawkins Health Center, and you know that work is being done also at Harbor UCLA Medical Center, and all of that is a part of the experience of the southern portion of our county. And so a great investment is being made. And these services are going to be high quality. They will be accessible to the entirety of the community, and that's essentially what we want to see happen. There will be public-private partners, some of whom you've heard about, those clinics that help us do what we need to do. They are free and or low-cost community partners. There will be school-based health centers in our environment. The private hospitals will be a part of the picture, as well as our teaching and academic institutions. In other words, we will be having it going on in this environment. Am I right about that? So in many respects, Dr. Fielding, it's fitting that this first new building that we're bringing to this campus is a public health clinic where we will promote wellness, prevention, and education. Repeat after me: wellness, prevention, and education. And let me just look at the specific things that this new South Health Clinic will focus on. It will deal with the serious issue of sexually transmitted diseases. The experts, the specialists in this environment will be here to work on that matter. It's a long-standing issue, but we will not give up until we make a dent in lowering STDs in the South LA communities. And then the obesity. That's right, you can clap about that. That's a serious issue. It's an old and new problem. And then we're going to work on the issue of obesity. Anybody think we ought to work on obesity here? We're going to tackle hypertension. Anybody think we ought to be working on hypertension? And then there's a matter of diabetes that we need to deal with. Anybody want us to deal with diabetes and prevention? And everybody who needs vaccinations and immunizations can come right here and get what they need and deserve. Our approach to this is to look at the entirety of the environment from a land use perspective. So when you think about it, we're bringing all the tools we can together for a full range of making for a healthier community. And so, Brother Ibarra, we're going to look at the metro station, Rosa Parks, to create more connectivity to the community. People need to be able to get here. one thing to have a building and nobody can get to it. What have you accomplished? And so we're looking at this holistically. There will be a fitness park here that encourages residents to walk and to exercise. We said we're going to work on the issue of obesity. This is an example of how we will be doing it. There will be a new library coming to this community, and that's what I'm saying. We got to do that. Healthy bodies, healthy minds is our objective and agenda. Then there will be community gardens to grow healthier foods. Anybody think we can use a little bit healthier food today? And so what we want to do is the following: create an environment where the business community can do what it needs to do to create jobs. And when I say jobs, I mean jobs and more jobs, all right? So what you need to know about this project is this project will have a local hiring component, because I want to see the people who live and work in this community to be able to work on this job as we build it, and that's what makes sense. So local hiring is the order of the day in this effort. And so just look around again at the religious community, educators, medical professionals, students, seniors, county employees. We are all here pulling together. And this is a huge investment. For this one project is $20 million alone. But when you think about all of the projects that I mentioned earlier, it is $800 million of public investment to make sure the quality of life and the standards that take place in this community are what they ought to be. You ought to give the whole Board of Supervisors a big round of applause for the work. We can't help but to say that when we are done over the next 2-3 years, it's literally 10,000 jobs in construction and development right here in this part of the county of Los Angeles. Literally 10,000 jobs. You ought to clap your hands and say somebody is going to get blessed by this. And so I want to thank the Chief Executive Office, the Department of Public Works, for their leadership. They're represented here today. They have done good work. And before we're done, I want to serve notice. Jacob and others, we're going to do better work. Somebody say better work. Better work! And so we are on to something worthwhile. Yes. And before I conclude these remarks, I just wanted to say we are just simply delighted that we have the opportunity to serve you, to represent in a way that means that the dignity and worth of every single resident of this community has to be acknowledged in the way in which we do the work to which we are assigned. This is our task, this is our challenge, and the people who are in our employ at the 2nd Supervisorial District understand that. And so I wish you to give them a big round of applause, from the Senior Deputy for Health to the Communications Deputy to the Constituent Services Deputy to the Chief of Staff, the entire team. You'll see them in their white polo shirts. Just raise your hands if you are on the team for the 2nd Super. Raise your hands. Don't be bashful. Put your hands in the air and act like you just don't care. You understand what I'm saying? They work hard. And they put up with me. You know that means they work hard. Lark, that was your cue, and I hope you took it. If you think this is a wonderful moment, well worth celebrating, clap your hands and give somebody next to you a high five and say, we're on our way to do something well worth so thank you very much. Ed, come forth, and Ed Maddox is going to give the instructions as to our next step. Thank you, and God bless you.
Let's go. 1, 2,